Dames en here, die akademiese prosesie sal binnekort inbeweeg. U word versoek om asseblief op te staan.
Bomma le bontate, molokoloko wa dirutegi o tla tsena mo nakong e kopana. Le kgopelwa go ema. Ladies and gentlemen, the academic procession will enter shortly. You're kindly requested to stand.
By the power vested in me, I hereby constitute this assembly as a legal congregation of the University of Pretoria. During this assembly, degrees and diplomas with all the associated rights and privileges will be conferred and awarded to the candidates whose name appear in the program. You may be seated. Ladies and gentlemen, we request you to join us in silent prayer or meditation to give thanks for the achievements of our students. Thank you. As Vice Principal of the University of Pretoria, I would like to extend a hearty word of welcome to each and everyone here this afternoon at this graduation ceremony. I would like to acknowledge behind me the Dean of the Faculty of Health Sciences, Professor Senkebuche, the Deputy Dean Teaching and Learning, Professor Steenkamp, the Deputy Dean Stakeholder Relations, Professor Soma Pillay, the Acting Deputy Dean Research and Postgraduate Studies, Professor Dreyer, as well as also joining us this afternoon, the Dean of the faculty from 1996 to 2001, Professor Dion Duplessis, as well as the Deputy Dean, who was Deputy Dean during the period 2005 to 2012, Professor James Kerr. And then I would like to acknowledge the presence of our Assistant Director of Student Recruitment, Mr. Siboto, as well as all chairpersons of schools, all heads of departments, all directors, emerita and honorary professors, as well as all of our lecturers and their spouses. I also want to acknowledge the representative of the Student Representative Council, Juan Oosthuizen, who will present the SRC Academic Honorary Colors. And then, of course, the reason why we are here this afternoon, a special word of welcome to all of you who will be receiving degrees and diplomas this afternoon. Also, a word of welcome to your family, your spouses, your parents, your partners, and then also to any other partners, parties, or dignitaries of whom we may not be aware of. There are certain professions that people encounter at the most vulnerable moments of their lives, moments of uncertainty, moments of fear, or moments where compassion, skill, and above all, professionalism matter deeply. And the health sciences occupy that space. And that is why this afternoon's ceremony carries particular significance. This afternoon, we celebrate a bumper crop of 370 graduates, and this includes 18 doctoral degrees, 92 master's degrees, 258 bachelor's degrees, and 2 postgraduate diplomas. And these qualifications represent years of study, years of being disciplined, years of sacrificing, but also years of resilience. Behind each of these degrees is a journey that's marked not only by academic effort, but also by long hours of training, of practical learning, of clinical experience, and an unwavering commitment to serving others. So let me begin by congratulating each and every one of you on this important achievement. The University of Pretoria, through its Thrive UP 2038 strategy, is committed to advancing knowledge that is relevant, impactful, and responsive to society's needs. And few faculties reflect this commitment as directly as the Faculty of Health Science. The faculty continues to make significant contributions across medical research, public health, healthcare innovation, clinical training, and community-based healthcare. Through its teaching, its research, and its partnerships, it plays an important role in strengthening healthcare systems and improving lives across South Africa and beyond. Its work is grounded not only in academic excellence, but also in service. And that service matters because we continue to live in a world that is shaped by complex health challenges, ranging from infectious diseases to mental health concerns. Also, of course, we are battling unequal access to healthcare and increasing pressure on health systems, not just in South Africa, but across the globe. And these challenges remind us that healthcare is not only about treatment, it is also about dignity, it's about equity, it's about prevention, and it's about care. As graduates in this field, this now becomes a shared responsibility. Whether you go on to work in hospitals or clinics or laboratories, research institutions, public health environments, communities, or your own private practice, your contribution will matter in deeply human ways. You will work with people at moments when reassurance matters, when trust matters, and when compassion matters just as much as technical expertise is important. The ability to apply knowledge with precision is important, but also the ability to listen, to understand, and to treat people with care and dignity. And that balance is what distinguishes truly exceptional healthcare professionals. And I want to believe that this faculty that's represented here by the lecturers behind me has ensured that you walk out of this hall today with that balance firmly instilled into each and every one of you. Many of you also, of course, completed your studies during a period when the importance of healthcare profession and professionals became even more visibly globally. We all still recall 2020 and the importance and the important light that it has shined on healthcare. Your decision to enter this field reflects not only ambition, but purpose. And that purpose matters, because the work that you will do will extend far beyond your individual careers. It'll affect families, it'll affect communities, and in many instances, entire lives. But also, I think COVID has indicated to us that it impacts society overall. And without health professionals in moments such as this, where we have a global crisis, we will not be able to survive as humanity. And so as you move forward, I encourage you to remain committed not only to professional excellence, but also to empathy, to ethical practice, and to lifelong learning. Healthcare continues to evolve rapidly. New technologies, new research, and new challenges will continue to shape the profession. The willingness to remain curious, to be adaptable, and to be compassionate will therefore remain essential. But dear graduates, as I conclude, today also marks the beginning of your journey in a new role as alumni of the University of Pretoria. And so we hope that you will remain part of this wonderful institution, because as alumni, you will be part of a greater network, a network of university alumni, but also a network of faculty alumni, and perhaps of your school as well. So please stay connected to your peers and to the broader alumni network, because we need you as well as alumni to continue on the work that we are doing as a university. May you continue to serve with integrity, lead with compassion, and use your knowledge to improve the lives of others. Thank you. I now request the Dean to introduce to me the candidates present whose names appear in the program.
Madam Vice Principal, the supervisors will now introduce the doctoral candidates from the School of Medicine.
Madam Vice Principal, I introduce to you Afra Tsitsi Basera, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Identifying Splicing Signatures in High-Risk Human Papillomavirus Infected Cervical Cancer Cells in response to serine adenine protein kinase 1 inhibitor using transcriptomics, prepared under my supervision and with Dr. Rahaba Mahotso Marima as co-supervisor. This thesis titled Identifying Splicing Signatures in High-Risk Human Papillomavirus Infected Cervical Cancer Cells in response to serine adenine protein kinase 1 inhibitor using transcriptomics. The candidate explored how inhibition of the splicing regulator SPRK1 shapes the molecular landscape of cervical cancer cells with differing HPV statuses. By integrating cell-based assays with transcriptomics analysis, the research assessed the impact of the SRPK1 inhibitors FINX3-1 on gene expression and alternative splicing. These findings revealed distinct HPV-dependent transcriptional and splicing responses, underscoring the central role of SPRK1 in coordinating RNA processing in cervical cancer. The study highlights potential of SRPK1 as a therapeutic target and demonstrate how transcriptomic profiling can identify biomarkers of treatment response and molecular vulnerability. This work contributes contributes valuable insight into the interplay between viral oncogenesis and host splicing regulation, providing a foundation for future investigation into targeted therapeutic strategies for HPV-associated cervical cancer. Madam Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
Madam Vice Principal, I introduce to you Ndweleni Mishek Bida, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Evaluation of Tumor-Infiltrating Lymphocytes Using Cytokines as Biomarkers for Prognosis of Melanoma in Black South African, prepared under my supervision and with Professor Isioma Ekbuniwe as co-supervisor. This thesis, titled Evaluation of Tumor-Infiltrating Lymphocytes Using Cytokines as Biomarkers for Prognosis of Melanoma in Black South Africans, provides groundbreaking insights into the prognostic role of tumor-infiltrating lymphocytes as cytokines in melanoma among Black South Africans. Through a comprehensive study of 205 melanoma patient samples, the research demonstrates that histological TIL categorization, when combined with cytokine profiling, provides reproducible and functionally meaningful prognostic biomarkers. The study's multi-platform approach, spanning immunohistochemistry, transcriptomics, and structure-based molecular modeling, revealed clinically significant discordant cases, underscoring the limitation of morphology alone. Importantly, it confirmed robust cytokine immune association and provided mechanistic insights into therapeutic targeting of BRAF mutations. As the first systematic evaluation of TILs and cytokines in a South African melanoma cohort, the work addresses a critical gap in global cancer research by focusing on African patient populations. Its findings establish a new framework for integrating histology, molecular profiling, and computational modeling to guide precision oncology and improve outcomes for melanoma patients in underrepresented settings. Madam Vice Principal, I request you to confer the degree on the candidate.
Turn to me. I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
Madam Vice Principal, I introduce to you Jessica Yvonne Cronier, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled A Fiber Digitization Study of the Architecture of the Converging Components of the Achilles Tendon in Neonatal Cadaveric Sample, prepared under my supervision with Prof. Ali Mirjalili from the University of Auckland and the late Prof. Anne Arger from the University of Toronto as co-supervisors. In her thesis, the candidate serially dissected and digitized the musculo-aponeurotic complex of the triceps surae in neonatal anatomical donors. The digitized constructs were analyzed for architectural parameters to establish baseline data of healthy neonatal architectural surae muscles, and this data could assist earlier identification and in tandem enable earlier onset of interventions for newborns affected with pathologies such as cerebral palsy and Duchenne muscular dystrophy, which often involve the triceps surae. Results from this study provides the first quantifiable means to compare the whole volume architecture of neonatal, infant, and adult triceps surae. The findings demonstrate that architectural specialization for fourth generation and excursion is present from birth, whereas stabilization develops with growth and ambulation. Functional applications of the findings include biomechanical, functional, and growth dynamics analysis, as well as future applications of contractile tissue response to pathology and disease affecting the triceps surae in newborns. Madam Vice Principal, I request that you confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
Madam Vice Principal, I introduce to you Caroline Jane Foden, who has compiled with the requirements for the degree Doctor of Philosophy with a thesis titled A Multivariate Multi-Omic Study on the Pathogenesis of Moderate to Severe Neonatal Encephalopathy with Suspected Hypoxic Ischemic Encephalopathy, prepared under the supervision of Professor Michael Pepper and with Professor Fourie Hubert and myself as co-supervisors. In her thesis, an investigation was conducted to enhance the understanding of the pathogenesis of neonatal encephalopathy with suspected hypoxic ischemic encephalopathy, also referred to as NESHI, a condition that frequently results in severe disability. The candidate identified significantly associated genetic variants based on allele frequency and predicted functional impact, and integrated clinical, transcriptomic, proteomic, metabolomic, and epigenomic data to uncover convergent biological themes within key genetic functional groups. This multi-omics synthesis revealed mechanistically consistent themes, particularly in neonates with severe or worsening clinical trajectories. This thesis provides the first known integrative genomic and multi-omics analysis of NESHI in an African cohort, uncovering axes of vulnerability, offering potential mechanistic explanations for poor treatment response, and defining a roadmap for future research in this field. Madam Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
Madam Vice Principal, I introduce to you Shavana Governor, who has compiled with the requirements for the degree Doctor of Philosophy with a thesis titled Morphology and Histology of the Facial Nerve within the context of three-dimensional computational modeling in cochlear implants, prepared under the supervision of Prof. Tanya Hanekom and with myself and Dr. Ayanda Nguena from the University of Witwatersrand as co-supervisor. In this thesis, Morphology and Histology of the Facial Nerve within the context of three-dimensional computational modeling in cochlear implants, the candidate developed a comprehensive reference data set detailing the morphological and histological characteristics of the facial nerve. The data set aims to inform volume conduction and neural excitation models that can be applied in the clinical management of cochlear implant recipients. She developed an innovative dissection technique to assess the accuracy of CBCT scans for the morphometric analysis of the facial canal, comparing them to direct anatomical measurements. Differences were found between the two methods, providing correction factors that need to be considered when constructing person-specific three-dimensional models. The candidate provided essential previously unavailable microstructural data on the intratemporal segment of the human facial nerve, which may help overcome limitations in existing computational models by improving their accuracy and accounting for person-specific variations. These findings are particularly valuable for refining three-dimensional computational models of the cochlea involving the facial nerve to predict the thresholds for facial nerve stimulation. Madam Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
Madam Vice Principal, I introduce to you Dr. Veren Geppersat, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Measurement and Training of Self-Effacing Empathy in Adolescent Parent Dyads in South Africa. In his thesis prepared under my supervision, the candidate prioritized the experiences of the one with whom is empathized rather than the one who empathizes, in developing an empathy measuring instrument and an empathy training intervention. The thesis showed that the new instrument, the self-effacing empathy scale, was both valid and reliable, and that the self-effacing empathy training of 8 weeks duration was effective in a randomized, placebo-controlled, parallel blinded study design. Empathy increased significantly in both adolescents and parents, with adolescents showing larger gains. Supported by a valid and reliable measuring instrument, a self-effacing kind of empathy can be targeted in strengthening family relationships, with implications for adolescents having longer-lasting and more rewarding relationships later on, and preventatively reducing the risk of a mental disorder. Madam Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
Madam Vice Principal, I introduce to you Miksha Hariprasad, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Assessment of Population Affinity Among South African Subadults Using Cone Beam Computed Tomography Scans, prepared under the supervision of Dr. Alison Riddle, with myself, Dr. Charlotte Thay, and Professor Kira Stull as co-supervisors. In this thesis, the candidate addressed a critical gap in forensic identification by developing methods to improve biological profile estimates of unknown subadults in South Africa. Using 3D imaging, she examined cranial variation among Black, colored, Indian, and white subadults aged 0 to 16 years. The study provided a proof of concept for applying current adult methods, namely macromorphoscopic, geometric morphometric, and craniometric analyses to subadults, demonstrating that craniometrics were most effective for assessing population affinity. By integrating these methods within a unified framework, she showed how digital approaches enhance accuracy and reproducibility in forensic evaluations. This work establishes the first population-specific reference for South African subadults and represents a key step towards standardizing subadult methods in forensic anthropology, ensuring emerging technologies can be reliably applied in real-world medico-legal identification. Madam Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
Madam Vice Principal, I introduce to you Katemu Patrick Kambui, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Molecular Epidemiology of Extended Spectrum Beta-lactamase and carbapenemase producing Klebsiella pneumonia from environmental water, broiler poultry and humans in South Africa, prepared under my supervision and with Professor Pateau and Professor Kwekana as co-supervisors. In this thesis, the candidate investigated the molecular epidemiology of antimicrobial resistant Klebsiella pneumonia isolates from environmental water, broiler poultry and humans in South Africa, following a One Health approach. Using laboratory-based phenotypic and molecular assays, he demonstrated that clinically relevant Klebsiella pneumonia high-risk clones and resistance plasmids responsible for the dissemination of multi-drug resistance genes are circulating in water and food-producing animals, posing a major risk to humans. The study highlights the urgency of the following: reduction of antimicrobial usage at the farm level, establishment of an improved regulatory framework for antimicrobial usage in food-producing animals, lifelong educational programs for veterinarians, para-veterinarians, and farmers, and continued antimicrobial resistance surveillance, and farm-to-fork initiatives to reduce the risk to public health. Madam Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
Madam Vice Principal, I introduce to you Dr. Jaco Kotze, who has complied with the requirements for the degree Doctor of Philosophy with a thesis title, Establishing the Role of Vitamin D Signaling Through Metabolomic Profiles and Adaptive Immune Markers in Keloid Pathogenesis in a cohort of dark-skinned Africans, prepared under my supervision and with the late Prof. Mark Veer and Professor Alisa Govender as co-supervisors. The study delivers the first integrated immunometabolomic investigation of keloid disease with a dark-skinned South African cohort. Harnessing advanced metabolomics and multiplex cytokine profiling, the work uncovers a distinctive immunometabolomic fingerprint, highlighting interleukin 10, interleukin 7, CD62P, and CD40L as key markers associated with keloid severity, independent of vitamin D levels. While challenging conventional assumptions about vitamin D deficiency, the candidate's systems biology approach illuminates novel lipid-mediated inflammatory pathways and immune fibroblast interactions. The thesis sets a new benchmark in dermatological translational research for underrepresented African populations, proposing precision-targeted strategies for keloid treatment. It not only redefines the role of vitamin D in scoring, but also paves the way for biomarker discovery and personalized therapy in keloid and fibrotic skin diseases. Madam Vice Principal, I request you to confer the degree onto the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
Madam Vice Principal, I introduce to you Khomotso Menamatabe, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled The Association of Prostate Cancer Progression with Perineural Invasion and Neoneurogenesis, prepared under the supervision of Prof. Mike Sateche. In this thesis, the candidate aimed to investigate the interaction of prostate cancer with the peripheral and central nervous systems, cadaveric dissection, serum neurospecific enolase levels, prostate tissue proteomics, GA68, PSMA, PET, and CT imaging, and magnetic resonance imaging of patients with prostate cancer were used. The study confirmed that prostate cancer interacts with the peripheral and central nervous systems. The equal occurrence of bone and soft tissue metastases challenged the long-held belief that prostate cancer preferentially spreads to bones. Perineural tumor spread was shown on MRI. The protein pro-neuropeptide Y was markedly elevated in patients with prostate cancer, the significance of which is yet to be determined. The findings of the study also serve to refine the concept of neurogenic metastases as a possible fifth route of cancer spread. Madam Vice Principal, I now request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
Madam Vice Principal, I introduce to you Skhumbuzo Zukembat, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Genome Analysis of Esophageal Squamous Cell Carcinoma in Patients with Human Immunodeficiency Virus and Human Papillomavirus Infections, prepared under my supervision and with Professor Aristotelis Chatzino as co-supervisor. This thesis, titled Genome Analysis of Esophageal Squamous Cell Carcinoma in Patients with Human Immunodeficiency Virus and Human Papillomavirus Infections, provides the first comprehensive genomic analysis of esophageal squamous cell carcinoma in patients with human immunodeficiency virus and human papillomavirus infections in South Africa. The study explored tumor mutational burden, alternative splicing, and microRNA expression profiles using advanced sequencing technologies. Findings revealed a distinct molecular signature of TMB-low tumors characterized by protocathedrin and non-coding RNA alterations and a unique splicing phenotype. High-risk HPV-16 and HPV-18 were predominant, with HIV co-infection observed in a significant proportion of cases. The research identified the microRNA 29 family as key regulators of tumor invasion through the repression of MMP2, offering new insight into esophageal squamous cell carcinoma pathogenesis in African populations. This pioneering work contributes to the understanding of virus-associated cancers and establishes a genomic foundation for precision oncology tailored to African patients. Madam Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
Madam Vice Principal, I introduce to you Audrey Nell, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Anatomical Description of the Cervical Approach to the Erectus Spinae Fascial Plane Block in a Fresh and Embalmed Cadaveric Pediatric Sample, prepared under my supervision with Dr. Sebastiani Govender-Davies from the Sefako Mokgatu Health Science University as co-supervisor. In her thesis, the candidate conducted one of the first comprehensive anatomical investigations of the cervical erectus spinae plane block in neonatal anatomical donors. Combining detailed dissection with computed tomography imaging, she defined the morphology, fascial relationships, and potential pathways for local anesthetic spread within the cervical region. The research establishes foundational reference data for understanding the anatomy relevant to performing this block safely in children. The study provides critical insights into anatomical variability across developmental stages, informs future imaging and ultrasound-guided techniques, and, through the candidate's anatomical descriptions, enhances procedural safety and accuracy by informing pediatric anesthesiologists. The candidate's work represents a significant contribution to pediatric regional anesthesia, expanding anatomical knowledge and supporting improved clinical outcomes and reduced complication rates in the youngest and most vulnerable patients. Madam Vice Principal, I request you confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
Madam Vice Principal, I introduce you to Rochelle Rademan, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Genetic Biosurveillance and Characterization for SARS-related Coronaviruses from Rhinolophus bat populations in Limpopo, South Africa, prepared under my supervision, Professor Waldemar Kotter, and the co-supervision of Dr. Marika Geldenhuys-Venter. In this thesis, the candidate investigated the viral diversity, ecology, and epidemiology of coronaviruses circulating in South Africa, horseshoe bats. Through longitudinal surveillance, and extensive coronavirus diversity was described with identification of ecological and host traits associated with seasonal viral excretion peaks. The research further demonstrated unique virus-host interactions and evidence of viral sharing among co-roosting species. Notably, the candidate recovered the first full genome sequences of these viruses from bats in South Africa and highlight the phylogeographical differences among these viruses. She also identified recombination events between East and Southern Africa lineages. These findings provide a foundation for zoonotic risk assessment and One Health approaches to mitigate spillover at the human-animal environmental interfaces. Madam Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
Madam Vice Principal, I do apologize. I introduce to you Daniel Johannes van Tonder, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Anatomical Investigation of the Anterior Lateral Abdominal Wall in a Pediatric Sample, a Cadaveric Vascular Risk Assessment and Computed Tomographic Surface Anatomy Study, prepared under my supervision with Professor Natalie Keogh from the University of Warwick in the UK and Professor Martin van Niekerk of the University of Pretoria as co-supervisors. In his thesis, the candidate conducted a comprehensive investigation using both anatomical donor dissection and CT analysis. To our knowledge, the candidate provides the first quantitative description of the vasculature of the neonatal anterior abdominal wall. The study also systematically described the superficial and deep vasculature or vascular structures in relation to key landmarks for minimal access surgery, as this approach carries a significant risk of iatrogenic injury to blood vessels and organs in neonates, a risk which is exacerbated by lack of quantitative anatomical data for this population. This research makes an original contribution to pediatric surgery by providing an evidence-based anatomical guideline for laparoscopic port placement, supporting a midline surgical approach, and confirming that direct visualization should be prioritized if ports are placed laterally. This anatomical framework could help surgeons optimize port strategies, reduce complications, understand the deeper anatomy, and enhance procedural safety for neonatal patients. Madam Vice Principal, I request you confer the degree on this candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
This thesis on metabolic surgery and its new perspectives addresses the baseline demographics, metabolic outcomes, and economic implications of the Roux-en-Y gastric bypass and the biliopancreatic duodenal switch, the latter being inclusive of the later development of the SADI. This research is the first in the history of Southern Africa. Worldwide, the election of primary surgery procedures has remained very challenging. Post-operative remission of chronic diseases, metabolic wellness, and health economic gain post-surgery still remain the ultimate goldstones, and this was outlined in the thesis. The previous reservation about the BPD surgical operation for only a higher BMI has now been regarded as flawed. BMI as the sole parameter became a non-distinctive entity. This was further underscored when 56 World Commissioners worked tirelessly to formulate the new definition of obesity as a chronic disease. Remission of diabetes remains the most sought-after health economic goal for this country. And this thesis executed it as approached it with absolute scientific rigor and undisputed outcomes. Remission of an additional 7 chronic diseases related to obesity only then served to underscore this even further. It is imperative that execution and aftercare remain within the ambit of high-volume, internationally accredited centers. An exceptional level of knowledge of total parental nutrition, correct vitamin and mineral replacement will always form the basis of successful outcomes of this very important field of medicine. The thesis then also addressed the impact that obesity may have on epidemics such as COVID. Dr. van Vollensteer, a proud moment for you and the university.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
Madam Vice Principal, I would like to introduce to you Gerardus Martinez Boshoff, who has complied with requirements for the degree of Doctor of Philosophy. It is a joint degree with the Transnational University of Limburg, Belgium, with a thesis entitled Validation of the Walking Egg in Vitro Embryo Culture System with Applications in a Mobile Laboratory Setup. It was prepared under my supervision with Professor Willem Ombelet as the co-supervisor. In this thesis, the candidate investigated access to assisted reproductive technologies, abbreviated as ART. The research project was presented in 3 parts: an inquiry to ART in public sector in South Africa, the construction of a prototype mobile IVF laboratory, and a proof of concept studying showcasing the use of the laboratory with live birth across ART cycles. The thesis indicated of how mobile IVF laboratories can improve access to ART with examples in both the private and the public sector. Madam Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate. Congratulations.
Madam Vice Principal, the following candidates have complied with all the requirements for the degree Master of Early Childhood Intervention. Ali Aisha. Laurenzi Barenzi. Ashley Brecher. Kate Forbes. Gloria Gickas. Bongi Wetlongwane. Nicole Yateson. Minenhle Mhlongo. Fezile Mkhwanazi. Dineo Mutlokowa. Tepongwana. Karen Smith. Bailey Squires. Madam Vice Principal, the following candidates have complied with all the requirements for the degree Master of Medicine in Anesthesiology. Liesel Duprier. Tirabeli Malenze Tanwani. Noel Westhuizen. Almarie Wust. For Master of Medicine in Anatomical Pathology, Umpone Siasibo. For Master of Medicine in Family Medicine, Esla Ahmed. Chibwaya Kabongo. For Master of Medicine in Internal Medicine, Barend Passon with distinction. Marlene de Kock with distinction. Camila de Swat. Sarah Gian-Gregorio with distinction. Mamputi Miso. Refilwe Puleng Mukulukulu. Taton Dlovu. Kiabetswe Sietsi. For Master of Medicine in Neurosurgery, Nhlanhla Dlamini. For Master of Medicine in Obstetrics and Gynecology, Isaac Mutau. Rifa Moeti. For Master of Medicine in Ophthalmology, Maputi Nong. For Master of Medicine in Orthopedics, Jan Duplessis. Johannes Dupré with distinction. Silas Mabitsela. Lise Kosana. For Master of Medicine in Otorhinolaryngology, Mike Kwaye. Pieter van Rooy. For Master of Medicine in Pediatrics, Pieter Brett Crick. Sneha Desai. Daniela Marquez. Fulufelo Matodzi. Anne-Marie Olivier. Mutlajo Tapanyenga. For Master of Medicine in Plastic Surgery, Matlodi Matenji Baloy. For Master of Medicine in Psychiatry, Michael Ferrerinha. Master of Medicine in Radiation Oncology, Elsabe Ruiz. Master of Medicine in Surgery, Tiatu Ravele. Master of Medicine in Thoracic Surgery, Pemelo Leo. Master of Science specializing in anatomy, Sharon Clutie with distinction. Madam Vice Principal, I want to pause a little bit here. For this next cohort of the Master of Science specializing in community-oriented primary care, these are the pioneers of the degree. This is the first time that we're awarding the degree of Master of Science specializing in community-oriented primary healthcare. Lonwabo Mjuza with distinction. Slindile Mngwango. Sizwe Matabela. Sibueng Ramatsokotla. Master of Science specializing in human physiology, Alia Dadamia with distinction. Maxine Hanan. Courtney Hill with distinction. DNA Mans. Lebogang Mashiko. Sanele Matibela with distinction. Tlutlu Matladi with distinction. Amogelang Sidibe with distinction. Salome van Eden. Master of Science specializing in medical immunology, Vidasha Chilan. Yeshrin Naidu. Bernie Peterse with distinction. Master of Science specializing in medical microbiology, Anthea Leroux with distinction. Zander Niehaus. Kayeleen van Sale with distinction. Master of Science specializing in medical oncology, Lorraine Maibeli. Master of Science specializing in medical physics, Lerato Motlalefat. Master of Science specializing in medical virology, Lekaila Barakrishna with distinction. Tumelo Fortin. Gabriela Grobla. Vanessa Paratu. Master of Science specializing in pharmacology, Ramsha Majid. Master of Science specializing in sports medicine, Thabo Malika. Celeste van Lochrenberg with distinction. Master of Science specializing in sports science, Danielle Masters. Bradley Holmesy. Tanya Posma. Madam Vice Principal, the following candidates have complied with all the requirements for the postgraduate diploma in general ultrasound. Zamile Mankatla. Madam Vice Principal, the following candidates have complied with all the requirements for the degree Bachelor of Medicine and Surgery. Blessing Anhiente. Tyra Alice with distinction. Mercy Amoko. Clara Annandale. Jonathan O. Michelle Bajis. Tana Baker with distinction. Bjorn Barnard with distinction. Lisa Becker with distinction. Lunati Bongoza. Alida Bun with distinction. Willem Hendrik Boesen with distinction. Shantae Bosch with distinction. Carla Botma with distinction. Saniel Brinjal. Catherine Buffy with distinction. Nhlakanipho Buthelezi. Nhlakanipho. Ciara Beitendorp. Thembisa Chuma. Sabrina Cerrone with distinction. Nadine Kutzer with distinction. Bronwyn Crawford Brunt with distinction. Cara Daniels with distinction. Jade Daras with distinction. Nicola De Bruin with distinction. Jen Lee de Klerk. Jacob Dekker with distinction. Snengosi Dludlu. Tato Diaho. Robin Dommel with distinction. Alvin Drabile. Kian Dutoit. Nicolene Dutoit with distinction. Renee Dutoit. Witske Dutoit. Mzimhle Gyota. Michelle Easton. Kwan Edwards. Sidra Faraka with distinction. Cameron Fisher. Jordan Fitzjohn with distinction. Wineley Flanagan. Minikazi Gama. Sandra Gloob. Ayabulela Gobe. Okuhle Gobile. Khutlilelo Gulolo. Nikshan Govender with distinction. Zoe Griesel with distinction. Sindisiwe Gumete. Kamogelo Hanyane. Mariam Hassan. Zinali Hayes. Moritz Hintel-Holzer with distinction. He also gets the award of the Vice Chancellor and Principal. And this award consists of a silver medal, as well as a cash prize and a certificate that is awarded to the candidate for outstanding undergraduate academic achievement during the undergraduate years of study for the first bachelor's degree in the entire faculty. He also gets the award of the SASOG Prize, which is to the best student in community obstetrics. He also gets the School of Medicine Prize to the best student with the best performance in the entire MBCHB degree program. And he also gets the Frikkie Engels Prize for the best achievement as student intern in neurology. Congratulations. Teboho Sam Hlatjoya. Nomthandazo Hlongwane. Ro Hui Huang. Tamsin Hunter. Lola de Ironeye. Muhammad Ishmael. Ilana Jacobs with distinction. Natasha Jacobs. Mia Jansen van Rensburg with distinction. Tertius Jansen van Vuren. Shamil Jiram. Tobani Georgie. Kamva Jokozela. Carla Yube with distinction. Cornell Juta. Claudia Katsapas with distinction. Butle Kekana with distinction. Tibilo Keta. Nzaka Kotsa. Lunga Kumalo. Sipo Chibuka. Candace Kingiela with distinction. Nadia Kitov. Pabalo Kokome. Daniel Kulat. Alicia Kotia with distinction. Mart Kotia. Emerentia Kriel. Marta Kritzinger. Iway Kriel. Lisa Kresha with distinction. Makaila Kun. Stefani Kupresan with distinction. Giselle Cindy Lai. Kayur Laka with distinction. Ryan Lannisman with distinction. Tapelo Lechodi. Monyane Letie. Rendani Ligidima. Jessica Locke with distinction. Skylar Lust. Carla Lutz. Shante Lowe. Gareth Libbe with distinction. Danae Lapke with distinction. Ki lebogile Maboko Thaba. Snegugu Madela Mkai. Onele Maduna. Titilo Madua. Amfariso Madzivandila with distinction. Kilito Mahlangu. Mahlatse Mahlobo Juana. Fatima Makda. Maxwell Mama Bulu. Tuma Mangojo. Buntu Mankumba. Brian Murray. Nolindo Masangwana. Helen Masekela. Riu Tabetse Masita. Matsubane Matlala. Tasmia Mayet. Matepo Mbatane. Avela Mbono. Nazneen Mir. Tanya Mijani. Estienne Millet with distinction. Mlungisi Mhlauli. Jenna Michael with distinction. Daniel Minna. Putego Makabela. Zusiphe Mtshele. Catherine Moffat. Sihle Mukhorosi. Mante Muhale. Kiarebetswe Mulaiwa. Lisigo Muluele. Tshepang Moloi. Ngaiseng Monti with distinction. Anne Moore. Ma Ditapong Murata. Diego Morupane. Shannon Morrison with distinction. Tobile Mutau. Tulani Mpanyane. Sarah Kambanja Mpita. Ayanda Msutwana. Shanae Miller. Takiti Mbali Mvakali. Eleanor Nzanyo. Nikisha Naidu. Londiwe Ndlovu. Sibusiso Ndlovu. Jacques Nel. Zukisani Goodman Nganasa. Gertrude Ngube. Simtandile Ngonyoza. Nhlanhla George Ngwenya. Ntokozo Nogogo with distinction. Tato Nonkumata. Zinhle Ntanjana. Thakane Ndlovu. Lindelwa Ntonto. Baphalo Ntsabele. Monya Leary Ulofse. Megan Westhuizen with distinction. Rochelle Westhuizen with distinction. Carmen Parker. Jade Phillips. Bryson Pillay. Kamlika Pillay Young. Tepang Pilusa. Chandra Pimentel with distinction. Monte Blakis. Julianne Potgieter with distinction. Siddhant Prithal with distinction. Hakisho Rabushaba. Vuyiswa Khatebe. Caitlin Raychart with distinction. Ntomeng Rametse. Ramasela Ramonai. Dia Rangasamy. Mule Rangata. Lwazi Khanji. Lerato Rasimane. Andrea Reddy. Ruben Reeves. Jonathan Raken. Javan Rupan. Kelly Rundle. Nina Sabi with distinction. Nompumelelo Saule Mudau. Simiso Savannah. Luke Sawkins with distinction. Daniel Skippers. Kabelo Sikutlung. Litlokhonulu Sikwele. Litabo Silima. Frederick Senegal with distinction. Mpho Sinusha. Fatima Bibi Sheikh. Dunisani Shimange. Faith Shongwe. Findlay Short. Tluhunulu Fatso Sibeko. Nkosi Kwenzile Sibisi with distinction. Nguleko Simamane. Himal Singh with distinction. Mushaisano Shivanga. Sanotolo Skenjan. Delhi West Kosana. Ketuktula Natonia Skosana. Bianca Smith. Rinde Sumera with distinction. Tina Songlishe with distinction. Megan Spitiles. Mignon Sprite. Nicholas Steenkamp. Ethan Steenkamp with distinction. Kayla Stroud with distinction. Danica Stradum. Kylie Stradum. Vihan Swanepoel with distinction. Emma Tar with distinction. Tulufelo Tamaye. Vele Tenga. Katleho Tubachale. Gerrit Tom with distinction. Jenna Titmus. Thokozile Toyana. Peggy Shabalala. Kitabile Tsilo. Esther van der Merwe with distinction. Marcus van der Merwe. Chiquita van der Reist. Elizabeth van der Westhuizen. Giselle van Mollendorf. Shanae van Niekerk with distinction. Marius van Niekerk. Menay van Nieuwenhuizen with distinction. Ruben van Rooyen. Anrone van Tonder. Hania van Wyk with distinction. Jacobus Wagner. Erin Wakefield with distinction. Kieran Velgemoot. Keith Whitehead. Sean Whitehead. Catherine Willocks. Anya Willie. Chloe Woodstock.
I now request the Dean to introduce to me the candidate for the presentation of the award of the Vice-Chancellor and Principal.
Madam Vice Principal, I have the honor to introduce to you Maurice Hinterholzer for the presentation of the award of the Vice-Chancellor and Principal. Maurice Hinterholzer complied with all the requirements for the Bachelor of Medicine and Surgery degree on the 17th of December 2025, and the degree was conferred with distinction. Maurice Hittelholzer is acknowledged as the overall top achiever in the entire Faculty of Health Sciences for the year 2025. Madam Vice Principal, I request you to present the candidate with the award of the Vice Chancellor and Principal.
I hereby present Maurice Hinterhalter with the award of the Vice Chancellor and Principal. I'd like to request all of the graduates to please rise. Let's give them a big hand of applause for all their hard work. Thank you. Now, graduates, around you are the family, the friends, the spouses, all the people who have supported you for a very, very long time and who have paid your fees. So please turn to them and you applaud them. And then last but not least, behind me are the people who've walked your academic journey with you. Please give them an applause. We have now come to the end of the proceedings, but before we close, I would like to invite everyone present here to liquid refreshments afterwards in the marquee in front of the Rembrandt Hall. You are requested to stand for the singing of the national anthem and to remain standing until the assembly has been dissolved and the academic procession has left the auditorium. The words of the national anthem will appear on the screens. Please rise. By the powers vested in me, I hereby dissolve this assembly of the University of Pretoria.
Canteamus sigitur, Iubenes Sure! The graduates have spoken. Let's give them what they want. Graduates! I'm going to more the graduates. Sure! I'm not and take it. Sanamare. Not and take it. Sanamare. Not and take it. Sanamare.